Farmies. I'd like to talk to you today about levothyroxine. So it's a thyroid medication that we give for hypothyroidism. So it is going to be a supplement for T3 or T4. It's going to be a synthetic form of T3 or T4. And this is kind of how I like to remember it. So here's your thyroid gland. And in this state, this is given for hypothyroid. So in hypothyroid, our T3 and T4 are low, and our TH is high, right? Because it's trying to stimulate that thyroid. Come on, do something. We don't have enough of T3 or T4. So the way I remember that this is for hypothyroid, I go level 0. Level 0. How much thyroid do we have? Nothing. So that's how you thyroid. Level 0. So here's our thyroid gland. Looks like a little butterfly. Here's our little butterfly in the middle of your neck. So we have hypothyroidism. We give some levothyroxine. And now what do we want? So this is the before over here. That's hypothyroid. This is what we want you to become is euthyroid, which is normal, right? Normal thyroid. So what we would expect to see is our levels of T3 and T4 to go up and our TSH to go down. So after we give our medication, here's our thyroxine, we're going to expect a reversal in our thyroid levels. So when we check our labs, our TSH should now be low because it's not going to need to stimulate anymore because the body knows it has enough of T3 and T4 now. So I want you to remember that we give this medication in the morning before breakfast. So I gave you a little sunshine. The other thing that's kind of interesting about this drug is that after you pick a brand, I gave you a bunch of brands. After you pick a brand of thyroid, whether it's the brand name or the generic or whatever it is, be consistent. Stay with the same brand. So you want brand loyalty with this one. It doesn't really matter which brand, but just stay with the same one, and then you get the same level of the hormone. The last thing I'd like to talk to you about is the effect of thyroid medications on your heart. So you guys all know how much I like cardiac, right? So when you have low thyroid, so here's hypothyroid, your heart is very weak. And you get a stiffening of your blood vessels. So this gets really rigid and stiff. That's with hypothyroid. Whoops. So we'll go with low thyroid. Gives you a weak heart rate. If you have high thyroid, hyperthyroid, your heartbeat goes really fast. We end up with increase in heart rate. So we can end up with tachycardia as a side effect if we go too far. So we want to improve that weak heartbeat, but by giving the levothyroxine, we can end up taking it too far. If we get too high of levels, we can start showing signs of hyperthyroid, which would be tachycardia. All right, guys, that's my levothyroxine given for hypothyroidism, level 0. How much thyroid do I have? Nothing. Level 0. So I give some levothyroxine, I improve my T3, T4 levels, I drop my TSH, and I got to watch out for some of my nursing administration issues, meaning I've got to give it in the morning, I've got to be careful to stick with the same brand, and I have to monitor my patients for signs and symptoms of hyperthyroidism. All right, guys. Whoops, wrong card. There we go. Synthroid. Hyperthyroidism. Remember that once your thyroid isn't functioning anymore, it does require lifelong treatment. So that's a medication that people are going to have to be on forever. So if they say, hey, as soon as I start feeling better, I can stop taking this med, that's the wrong answer. They have to take it forever as a replacement for their inactive thyroid. All right, have a great day.